All right, so we'll tap on protocols. You can see here we have either adult or pediatric protocols to select from. If we select adult protocols first, you just scroll down here, we'll see all of the MFR protocols for adult emergencies. And just for the purpose of this, we'll select adult basic airway. So you can see here there's an overview, a nice flow chart provided of the adult basic airway protocol. I'm going to zoom in here a little bit. So the protocol will start off with the standard approach and ongoing assessment, so scene safety, PPE, etc. And if we have someone, we'll say, who's unresponsive and they need to be ventilated, the first thing we're going to do is reposition and/or suction as needed. We're then going to ventilate with the BVM and the OPA NPA. If this provides us with adequate air entry, here's where we need to answer yes or no. So if we are getting adequate air entry, is there any impending airway obstruction? Is anything going to make this airway management case worse or occlude the patient's airway? If there's not good adequate airway entry, then they're promoting you to refer to the adult foreign body airway obstruction guideline. So let's say we're able to adequately get air entry into this patient. There's no impending airway obstruction that's going to occlude the patient's airway. So then we're going to ventilate for 2 minutes. Once we ventilate for 2 minutes, we're going to assess to see if the ventilation and oxygenation is effective. If it's not, we're going to reposition if required, and we're going to use the 2-person technique. If ventilation and oxygenation is effective, then we can continue treatment and assessment until transfer of care to EHS. So for the ventilation and oxygenation effective, so you may be asking, well, what are the signs of effective ventilation and oxygenation? So on the right side of these protocols, you'll see additional information that relates directly to that protocol. So sometimes there will be like a little asterisk sign at the top, and sometimes there will be a little asterisk sign in the box in the protocol that directly relate to each other. So in this case, signs of effective ventilation and oxygenation are not starred with the asterisks, but you can see here on the right side of the protocol, they list the signs of effective ventilation and oxygenation, such as improved skin color, improved heart rate, improved level of consciousness. I'll zoom out here. Now, probably my favorite part of this whole app is every adult and pediatric protocol at the very bottom, you can scroll down. It has supplemental or additional information. And this kind of explains why we do what we do and provides some additional resources or additional information on the respective protocol. So for this adult basic airway one, it talks about different mask ventilation techniques, the 2-person BVM technique, how to evaluate respirations. As you scroll down here, you can see additional information on managing unconscious patients, altered level of consciousness. And again, every adult and pediatric protocol has this. It's great supplemental additional information if you have the time during a training session, whatever you're covering in that respective medical training session, to read further into it. It's great information to have. So on my top left corner, I'm going to tap on the arrow. This will bring me back to all my adult protocols. I'll tap it once more. And as you can see, we have our pediatric protocols here. So I'll select that. Scrolling down, we have all our pediatric MFR protocols. And I'm just going to choose a random one here, pediatric spinal assessment. So you can see here it's laid out exactly the same as the adult protocol. Starts off with our standard approach and ongoing assessment. So here's where I'll point out with the asterisks relating directly from the protocol to the box on the right side. So as we work our way through this C-spine or spinal assessment protocol for pediatrics, you can see the box right here, spinal motion restriction if any of the mechanisms of injury are present. You see the 2 asterisks there. We'll scroll up here, there's the 2 asterisks on the right side. Mechanisms of injury that will most likely indicate the possibility of a spinal injury include. So that's what I was kind of talking about, where in the protocol, if you reach a box that has asterisks, it's probably going to be directly related to whatever information is on the right side of the protocol. And again, as we scroll down, the pediatric spinal assessment, additional information. There's lots of additional information here that has to do with mechanisms of injury, assessments, spinal motion restriction. Again, great information to have. So I'll tap my top left arrow here, bring me back to my pediatric protocol screen, tap it once more, and that brings us back to the adult and pediatric protocols. And if I tap that arrow once more, it brings me back to the home content screen.